My name is Shazia Nakhoda. I am a clinician and clinical investigator. I specialize in the treatment of B-cell lymphomas with a focus on chronic lymphocytic leukemia, mantle cell lymphoma, and other non-Hodgkin lymphomas. Today, we're going to be talking about different types of BTK mutations. As a physician that treats non-Hodgkin lymphomas, I've seen how important Bruton tyrosine kinase inhibitors have been in changing the landscape for prognosis. The main reason I wanted to get into this research is because this class of drug has changed how we treat B-cell lymphomas so drastically over the 10 years. And having been a trainee and now an attending, as the use of these drugs and indications evolved, it's really been a wonderful experience. Over the course of treatment with BTKis, mutations in BTK may emerge. In preclinical experiments, these mutations appear to have a varying impact on the ability of BTKis to bind to the BTK. Understanding the science of BTK mutations is important to maintaining the ability to target BTK. Note the preclinical data does not imply any relation to clinical outcome. In preclinical studies, BTKis bind to the BTK protein to block BTK activity. This inhibits B-cell receptor signaling, ultimately resulting in reduced B-cell proliferation. One important component of understanding how BTK mutations occur is realizing that kinase activity is not simply related just to the enzyme activity or catalytic domain, but it's also related to the protein-protein interactions or scaffolding function of other components or domains of the kinase. And we see that kinase activity is particularly important in defining kinase proficient or kinase dead activity. BTK mutations can be classified as kinase proficient or kinase dead. Both kinase proficient and kinase dead mutations may disrupt the binding of BTKis to the BTK domain. Kinase proficient mutations in the kinase domain of BTK result in a change of an amino acid. The amino acid change may partially impair the ability of BTK inhibitors to bind to the BTK protein at their binding site, and therefore the downstream kinase activity is able to still occur and lead to B-cell receptor signaling. In the case of kinase dead mutations, a mutation in the kinase domain of BTK causes an amino acid change similar to kinase proficient mutations. This causes a reduction in enzymatic activity of the BTK, resulting in downstream signaling of the B-cell receptor via bypass pathways. Kinase dead mutations may also disable BTK enzymatic activity, meaning that the BTK is unable to send signals to the other proteins. Despite this, kinase dead mutant proteins may augment downstream B-cell receptor signaling using a scaffolding function. In this bypassing mechanism, other kinases are recruited as alternative pathways, allowing B-cell receptor signaling to continue without BTK activity. Once B-cell receptor signaling bypasses BTK, it may no longer be a viable target for controlling B-cell proliferation. Please note, these are preclinical data, and their relation to clinical outcome has not yet been established. One of the first mutations to be described in the literature amongst different BTK inhibitors was the cysteine 481S mutation. And this was found to be the most common when we looked across the board. We're now seeing several other mutations also described, especially in the literature. So the most common kinase proficient mutations are the cysteine 481S and the T474I mutation. And some of the most common kinase dead mutations that we're seeing are L528W and A428D. And across several studies, we've seen that the range of detecting a BTK mutation is quite variable. This goes to illustrate that there's a lot we don't understand yet about BTK mutations, and this is really ripe for clinical and preclinical investigation. In some patients who are progressing on their BTK inhibitor, I may send BTK mutation testing to help guide my understanding. I think it's important to test for these so that we continue to expand our understanding of BTK mutations and drive research in the future. I think the preclinical data that I'm most excited about is how sequencing and combination therapies are really going to impact how these mutations manifest in the future. And so the mutations that we see down the line may be very different than the ones we're seeing now. It's really important that we understand how this impacts patients. Understanding what causes some patients to respond and others not to is critical in being able to use these drugs for as long as possible for our patients. BTK mutations are not an indication to change treatment. There are currently no clinical trials exploring the direct clinical impact of BTK mutations. Further research is needed to determine the mechanisms of resistance to BTK inhibitor treatment in patients who progress on a BTKi. I'm looking forward to more research that may provide a better understanding of BTK mutations in the future. Thank you for watching.